Welcome to Marketplace Tech Bytes. It's our weekly roundup of some of the big headlines in the tech world and maybe some you might have missed. I'm Meghan McCarty, Carino. This week, we review the year that was in health tech investments. The FDA has provided new guidance for AI-enabled medical devices, and a state law is set to scrutinize AI use in insurance claims. Here to discuss all that is our regular contributor, Christina Farr. She's a managing director at Manatt Health. Hey, Christina.
Hey, thanks for having me, Meghan.
So good to see you. Well, we want to start with our bite of the week. This is a number that gives us some insight into this week's stories. Christina, do you have a number for us?
So this week, Meghan, I'm going to go with a health tech industry stat that I think will blow your mind. And it's actually two numbers. The numbers are 4 and 4.5 billion. And that is how much investment is going into digital health companies every quarter,
Wow.
according to Silicon Valley Bank. Crazy.
Yes, amazing. And so this was a good year. I'm assuming that's a good figure. There was a little bit of a drop off in health investment in 2023. I think over the last week, of course, healthcare, health insurance, the whole healthcare industry has been a hot topic, a very fraught topic. But today, we just want to get into kind of the health technology side of it, and that is your specialty. So as you noted, when it comes to health tech investment, 2024 was a good year. Why was it such a good year compared to 2023? Can you explain that dynamic before we dive into kind of which type of, health tech companies might be getting that money?
So it was a good year, not as good as some of the years during the pandemic and immediately before, where we saw funding just absolutely blow
Right.
up through the roof in healthcare. I think a lot of that was just exuberance. People thinking that the whole future of healthcare and medicine was going to be virtual.
Mhm.
And we believed that at a time when COVID was happening and a lot of medicine was virtual because people didn't want to get seen in person. And the laws changed and relaxed at that time to make it more possible. Things have remained somewhat, there's still a lot of telemedicine out there, but what we're seeing is a lot of plateauing in, general use and a lot more people going back into the doctor's office. Hospitals are seeing just more people come back as well, and that they are trying to bring people back into the physical, office or clinic. So it's now sort of maybe stabilized a bit, up from 23, which was a really bad year for companies raising money, and now I think we're seeing activity pick back up.
Okay, so we're out of this kind of pandemic era feeding frenzy, but where is the excitement and investment today?
Okay, so two words for you: artificial intelligence. That is where most of the funding is going these days. I speak with founders quite regularly who have told me that some funds that they've approached have candidly told them, if you do not have AI in the solution, we will not even meet with you.
Yeah.
It's actually an article I wrote a few weeks ago because I think we're overdoing it a little bit. I think there will be some big success in this sector for AI. There will be successes in other sectors as well. But it's not really the only thing to invest in. And most of the revenue flow, most of the way that the dollars flow through the system is still very much in services. It's still in that interaction that you see between a care team, care provider, and the patient. And I do think AI will make a difference. Like I said, I'm not bearish, but I don't think that we will be replacing any of that anytime soon. And we should stop investing. Like that's a near-term reality.
All right. Well, speaking of AI and healthcare, we want to turn now to some recently released guidance from the FDA about AI-enabled medical devices. So up to now, it's my understanding that it had been the case that any algorithms, machine learning used in medical devices had to be locked at the time of FDA approval. They couldn't be adjusted after. Now the FDA is providing guidance for modifying algorithms. Why is this important?
Yeah, this has actually been a topic for a while with some of the startups I've been working with and the regulators. And that's this issue of just, software in general. It goes even
Hmm.
beyond AI. And
Hmm.
it's that, software is something that needs to be constantly evolving. Like think about the updates that you receive all the
Right.
time on your phone. Um, and the regulation acts as if, or you treats these companies as if that isn't the case. And so, they have to wait a really long time before they can do a basic kind of software update. And that has gotten worse with AI because a lot of these systems are designed to be very adaptive. So I think that this is a step forward. And from, all the friends that I've spoken to this week in the med device world have said it feels kind of almost like a departure from what they expected. It's less conservative than what they expected. And
Hmm.
it definitely shows that the FDA and other regulators are working closely with technologists, with VCs, with entrepreneurs, the whole industry to try to figure out how to make this both safe and effective, which is the primary goal, but then at the same time not allow innovation to happen so that we can provide the best possible experience for patients. And I think it's a good thing.
Well, tell me more about, some examples that you might have in your experience of devices where the need to kind of update the software or update the algorithm, could improve the product.
Yeah, I mean there are so many of these, and you see them in areas everything from areas like atrial fibrillation, where you see kind of AI being used today very broadly, and it's there are even lots of studies that show that you take the best cardiologists in the country and you put them up against an AI, and that the AI is able to detect AFib more often and more accurately and frequently than a human. And a lot of it is because you're looking for very subtle signals as this relates to kind of the electrical signals in the heart. And I'm not a doctor, so I hope I'm not butchering it, but these are very subtle signals sometimes that to the human eye, even the most trained human eye, it can be impossible to pick up on that. So imagine a piece of software that is able to detect an AFib way sooner and earlier in a patient's trajectory. And then how do you kind of adapt that over time as the algorithm gets smarter. And I think that's what we're starting to see. And the studies that are coming out are very compelling. And it's certainly making its way to the FDA and other regulatory bodies.
All right. Well, finally, we want to turn to the role of AI in health insurance. Again, the insurance industry has obviously been a big topic of discussion in the last week. And one practice that may be getting kind of additional scrutiny in the future is the use of AI in the claims approval process. There have been a number of journalistic investigations into these practices. We've talked about them on the show. There is currently a lawsuit against United Healthcare and several other companies over their use of algorithms in their Medicare Advantage plans to determine what kind of care, how long care, they will cover. Number of insurance companies, including United, are also using third-party companies. That one that was recently investigated by ProPublica, which is using an algorithm to decide which claims are going to go for further review rather than being approved automatically. Christina, why has this become such a contentious issue?
It's a fascinating thing in my mind because even a decade ago, it felt to me that most people were not talking about prior authorization. It was just not a topic that was at the tip of anyone's tongue. That has all changed. And I would say even just in the past year and especially this week, everybody is talking about what is, in my opinion, the dark underbelly of the
Hmm.
healthcare system, and that is payments. And it's just think about the last time you bought a cup of coffee. I had a cup of coffee this morning. I know exactly how much it cost. It was, $8 because of inflation. And I made my peace with that and I got my coffee and that was the transaction. And in healthcare, it doesn't work that way. You go in for a procedure, the doctor tells you what you will likely need. And then you have no idea what the bill could be. It could be $20 or it could be tens of thousands of dollars. And this is the issue at stake with the idea of prior authorization, which is that the physician needs approval from your health plan to be able to do the procedure or prescribe the medication that, in their opinion, you may need. And so I think increasingly we're going to be moving to more transparency around the way that these payments work. And I am concerned that, technologies like AI will be used to kind of make these denials happen much more quickly and without human oversight. And I think you're seeing more now legal action around that to ensure there is a human being in the loop and not just an algorithm that, may be trained with certain biases and inequities, and is denying care that patients do in fact need.
Yeah, that human in the loop element seems to be at the heart of this California law that is taking effect in January. I understand, a number of folks in Congress are watching that law as a potential model. I mean, do you think we're going to see more attempts to, impose oversight on this specific use of AI?
I absolutely do. I think we'll see more pushes around having that human being in the loop. I think also in various states, lots of states are looking at prior authorization now and thinking about, what is the role of the physician? And if you have physicians agreeing that the patient does need this procedure, is prior authorization kind of always required? And is it the right thing for the system that we have? I also see people all the time, like in my world, talking about, whether there are alternatives to prior authorization that would not drive up the cost of care. Um, and then I also see, interestingly, AI being used on the provider side as well. I mean, we
Mhm.
talk a lot about its use on the payer side, but providers need to fight a lot of these
Right.
prior authorizations, a lot of these denials. And so,
Mm.
will they have their own AI tools that are sort of fighting up against the payer
Yeah.
side? And then what does that mean? Are we going to reach some kind of stalemate where we've got AI on both sides? A lot of the system right now works when somebody just gives up, right? And a human being eventually will give up, but an AI will never give up. So these are the kinds of questions that keep me up at night, especially as I kind of live in this world of health and technology.
All right. Well, fascinating stuff. I hope we can follow up on the AI versus AI battle in the future. Christina Farr at Manatt Health, thank you so much.
Thanks, Megan.
And thanks to all of you for watching Marketplace Tech Bytes Week in Review. Jesus Alvarado produced this episode. I'm Meghan McCarty Carino. This is APM.